we have to ensure when we are doing the surgery, that the skill set is exactly what is needed. And obviously, a combination surgery, I told you, would be better, like FUT, FUE. So be open for both. Okay.
Satya Hair Solutions,
where trust meets expertise.
Hello.
Yeah. Hey, how you doing?
Hi, how are you? I'm good. So you have sent the pictures as well, and
Yeah.
you are 30 years of age, Mr. Brown.
Yes.
And when did this hair loss start? At what age?
This try. Yeah. Well, I've been battling with it since when I was like 26.
26.
It's been like off and on.
4 years.
Yeah, like so.
Oh.
Yeah, like 4 years.
So any medication you have tried up till now?
Medication? No, I never tried any.
Have you heard about the medicines? Minoxidil, Propecia, Rogaine, anything?
Yeah, I heard about. Well, you want to know what? I actually tried. I think that's Monoxy.
Yeah.
I think, yeah. I ended up trying that one. That right there didn't really work for me.
Okay. Do you have any family history of baldness?
Yes. Yeah. All my uncles, all of them bald.
So there is
Sadly.
high probability that the thinning may progress in your case.
Yes. Yeah.
So could you just show me like this? Yeah. Okay. Fine. See, when we make a hairline which is low, we invest a lot of donor area, and once it is gone forever. So in case you thin out at the back of your head, you end up having a line which is low and then nothing here and nothing in the donor. So we have to make a conservative hairline. We shall not go for the line which you used to have earlier. Understood?
Okay.
So
Yes.
a conservative line. See, Mr. Elon Musk. Elon Musk got a transplant done in 2002. He kept a high hairline. Then he brought it down after waiting for around 7 years. He had lots of money even then, but he planned it. He planned it.
Yeah.
So okay, another important point here. Usually, African people have a flattish kind of hairline, like Michael Jordan and so many other people.
Yeah.
So you also want me to make a flattish hairline?
Yes.
Okay, fine. Okay, so see, this can be done, but I think you will be needing some medicines also to take care of existing hair loss. If the existing hair keep thinning, we'll be needing another transplant very soon. So we'll give you some medicine to take care of the existing ones, and then we'll do the transplant in this area. There are two techniques, FUE and FUT. You have heard about them?
Yeah. I was actually liking the FUE. I think that's the non-invasive. I think.
Okay, I'll tell you. Yeah, you are right. FUE is the newer version where we don't have to cut a strip, no stitches. We just pick one by one and we implant. Okay, but because you have curly hair, sometimes what happens, these curls are so intense. The instrument which we use is straight, like it's a straight punch, and we don't see the roots when we are punching it. So when the root curls inside the hair, inside the skin, we might end up cutting or damaging the hair. You understand this?
Okay.
So in such cases, it is better to do FUT because there we just cut the strip, we visualize the roots, and we dissect that root out of the body under microscope.
Okay.
So the graft transaction rate or wastage of the grafts is pretty less. Although FUE is possible, when you come, we'll first try FUE itself. Okay, but yes, just in case we find that the roots are very curly, we'll switch to FUT. We do both.
Okay.
We do both. But let's keep this option because this is very important. Suppose if you go to a clinic which does only FUE, when the clinic starts the procedure, and finds out that most of the grafts are getting damaged, they are not coming out intact. Since the clinic doesn't know FUT, they will just keep doing it and waste a lot of grafts there. Okay.
Okay.
So be ready for both. Uh, Although FUT is a better form of surgery because we get grafts from the safest donor zone. I hope you know about safe donor zone, unsafe donor zone. Do you know?
No.
Okay. So at the back of your head, I mean, this is the entire area from where we can take out the grafts. Out of this area, this is the portion from where no one loses hair. The above upper portion and the lower portion, people lose hair. You must have seen many people in your family.
Yes, yes.
So this is called the safest donor zone. This small band is called the safest donor zone. So when I'm doing FUT only, I take out grafts from the safest donor zone. Okay. And you consider this donor as an investment, because once gone, these hair are not going to come back. So we will decide a hairline, and the hairline which we mutually agree upon will do that number where we fill these gaps and we create a nice looking hairline which looks natural. Understood? I think you will be needing the medicine. We'll give you medicine at small doses which will take care of these hair. We may not need it. Yes, yes, I can see. A small transplant, maybe around 200 grafts I'll do in this area. Rest will be recovered through the medicine. In the frontal portion, we'll do around 1600 grafts in the frontal portion for the hairline. That's it. So the total number would be less than 2000. Okay. And a small dose of medicine I will just add after the transplant, which will help these hair to stay, so that we can sustain the results for longer period of time. Understood?
Okay.
A lot of people come to us because you know people do transplants all globally. Turkey especially is the capital of hair transplantation. But most of these results are 1 mg finasteride daily plus hair transplant. So that medicine adds so much to the transplant results that a poor transplant can be blown out of proportion and shown as a excellent, brilliant hair transplant. So here the surgeon skill is less. Medicine covers up for the lack of skill, and patient pays the price. So we have to ensure when we are doing the surgery, that the skill set is exactly what is needed. And obviously, a combination surgery, I told you, would be better, like FUT, FUE. So be open for both.
Okay.
Okay.
Thank you so much.
Thank you. Take care. Bye bye.
Okay.
Yeah.
Okay.
Thank you.
Take care.